everyone. Welcome to week 2 of your Pharmaceutical Career Planning 2 course. This week we are going to be covering Chapter 4. Chapter 4 is all about the legislation and the regulations that surround long-term care pharmacy. As you might expect, this is a very highly regulated area, and the main reason is because in the history of long-term care facilities, the conditions were just deplorable. They were really, really bad years and years ago. And because of that, we have a lot of laws and regulations that have come about since then. So Medicare and Medicaid were originally enacted back in 1965. And the CMS establishes requirements in order for a facility to be able to participate and be reimbursed for patients that are Medicare and Medicaid. So some of the conditions of participation are listed here. In order to be able to receive funds from Medicare and Medicaid, you have to have a monthly drug regimen review for every single resident. So if you have a pharmacy that is facilitating or providing medications to a long-term care facility, a lot of times that is part of what they do. They provide a pharmacist who actually comes in and looks at all the drugs that a patient is taking and reviews them. So, for example, when I actually worked for a long-term care pharmacy, and we had several pharmacists that worked for us, and each of them had their own set of nursing homes that they went to, and they would go in on a monthly basis and they would go through every single chart of every single patient to look for things like, how many medications are the patients taking? Is there duplicate, diagnosis that they're, duplicate medications that they're taking for the same diagnosis and things like that. So those are some of the different things that they might look for when they do their drug review. Then we also have what's called the Omnibus Budget Reconciliation Act of 1987. And so what this is, it's got a lot of moving parts to it. But one of the biggest parts of it is looking for any kind of unnecessary drugs. And when we think of unnecessary drugs, especially in a nursing home facility, it is antipsychotic drugs. Unfortunately, years and years ago, a lot of times what would happen was, doctors, nurses would, put a standing order in a patient's chart for them to have some sort of antipsychotic medication. And this was not because they were having any kind of psychotic episodes or they were having any kind of particular issue, but it was to control them. It was to make them kind of groggy and drugged, and they didn't have to do as much for that particular patient if they were maybe not as with it as they could have been. And so a lot of times those antipsychotic drugs were used for that. Now there are, of course, reasons for antipsychotic drugs and reasons that you might take them. And those are listed here on slide 11. These are some of the things that they may be allowed to give those types of medications for. A lot of it is things like schizophrenia, Tourette's, those types of things. So there is reasons to give antipsychotics, but all of these behaviors are not reasons to give those medications to those nursing home patients. And as you can see, a lot of those things that you see on this list are things that you're going to see in a nursing home setting. And, a lot of the elderly patients are going to have some of these characteristics simply because of age. Maybe they have Alzheimer's or some other, condition that, leads to some of these behaviors. But the whole idea is they can't just give them an antipsychotic drug so that they don't have to deal with the behaviors. So those are some of the big things regarding the laws and things like that for long-term care pharmacies. There are other things that are included in this slide deck, things like how the the patient has the choice to choose who's going to be their long-term care pharmacy. Maybe they don't want the one that is contracted with by the nursing home, and that's okay. They can make other choices. So all of those types of things are included in this chapter as well. It also kind of gets into some of the things about the DEA regulations, and what they can and cannot do when it comes to partial filling of scheduled drugs, Schedule 2 drugs, and things like that. So as you go through the material, if you have any problems or questions with it this week, please make sure that you reach out to me, and have a great week.